Women go through a world of changes during pregnancy. Hormones fluctuate, organs move and shift, and for many women, their libidos go into overdrive, with some saying their orgasms are the best they've ever had. But is sex during pregnancy safe for mom and baby? Hey, it's Natalia Reagan for D News. We got this great question posted on our subreddit which asked, does having sex while you're pregnant affect a baby's health or personality? First, there are no scientific studies on if sex affects the baby's personality. Maybe you should just ask your parents. But we can answer the question of if it's safe for the mother and child. Let's talk about what happens during pregnancy and how the baby is protected from the world at large, including your prodding penis. A fetus develops in an amniotic sac filled with fluid inside the woman's uterus. This resides behind the cervix at the end of the vaginal canal. About a month into pregnancy, a thick gelatinous mucus plug is formed and fills the cervical canal and contains antibodies to protect the fetus from infection. Thus, the fetus is well protected, which is a good thing because studies show women get a little extra randy while there's a bun in the oven. In a report from the Journal of Sexual Medicine, 40% of women interviewed said their sex drive increased since getting pregnant, which again might be a good thing because not only is it safe, there are actual health benefits to boning down. Doctors have reported that sex during pregnancy can have a calming effect, help a woman fall asleep, and lower blood pressure. And some women have even confessed that they've experienced the most intense orgasms while pregnant. These amazing climaxes are thought to be because the pelvic region is more sensitive and engorged in blood during pregnancy. Additionally, during orgasms, there is an extra release of oxytocin, aka the love or cuddle hormone. Oxytocin has been shown to help build trust in relationships, so getting busy can help strengthen bonds between partners during an already stressful time. And it's not just the act of sex, it's also the byproduct that can be helpful. A study done in Denmark found that a unique protein in semen could actually help reduce a woman's risk of developing preeclampsia, a potentially fatal illness that affects 3 to 5% of pregnant women. The illness develops when the placenta doesn't get enough blood. The seminal protein helps to regulate the body's immune system, thus lowering rates of preeclampsia. Now, in the past, there have been concerns that having sex while pregnant would potentially induce preterm labor. And while the release of endogenous oxytocin and the prostaglandins in semen do aid in the ripening of the cervix, there's no evidence that sex directly affects the Bishop score, which is a scale used to determine if the cervix is ready for vaginal delivery. Even though sex while pregnant has many benefits, there are instances when abstaining from intercourse is recommended, particularly when it's during a high-risk pregnancy. Women who have previously gone into early labor, or if their water has broken, as well as those that have a compromised cervix, placenta previa, or have a herpes outbreak or feel one coming on, are warned to abstain from sex. Obviously, this is different from woman to woman, and if you have any questions about safety, just talk to your doctor. Despite those potential complications, pregnancy sex is considered safe, fun, and beneficial for most women, so get to it. Just because you're housing a nutrient-sucking parasite doesn't mean you shouldn't be scragging, screwing, bumping uglies, or making love. Now that we've answered this salacious pregnancy question, here's Trace debunking 5 other pregnancy myths.
A big myth about pregnancy concerns fish. Fish is a staple of a healthy diet, and pregnant women are encouraged to eat fish. But it does contain trace amounts of mercury. Well, some fish do. Not all fish are equal, so you just need to eat the right fish.
What do you think? Have any more sex questions? Let us know in the comments below or on our subreddit, and we'll try to answer them for you.